So hello everyone, today is the first video of our lecture and this regarding this medical discussion that we are just going to tell. I want to just start with the regular outpatient basis statement and what we have currently now and what we're going to just have in the future, what we achieved in the past, like all these things. But basically speaking, what we understood from this very little amount of knowledge is that the things that just is there in the medical profession, the medical ethics. There are lots of negligence in every aspect. The patient is not being properly treated. So I will go today into the details of this ethics and negligence and all these things because this is another part of the forensic medicine and the medical ethics and etiquette we will discuss on another day. But today I will discuss the common cases, like the very common cases in this COVID pandemic situation is the cough, cold, fever, and this influenza-like illness. This is a very common thing. How to deal with this? Basically speaking, if you're at home, then you must isolate yourself for at least 14 days in detail. But in this situation, if at all you are vaccinated, just expect to quarantine yourself for around 7 days because more than 7 days is quite hectic for you and quite boring for you also because you have lots of work to do and your busy just a schedule of your life will be getting hampered by the quarantine period and you are quite bored by this thing and then you just can't stay in the this home for a long time for this reason. Our advice is and our guidance is to just quarantine yourself for 7 days, take good medicines, and then you can get yourself treated because COVID is not a kind of big issues here. But what is the big issue here is that just if you do not just care for this COVID, then what will happen? If you don't care for the COVID, then your lung will die first of all. If you are non-diabetic persons, if you have some sort of other illnesses like some comorbidities are there, then you must take precaution because COVID is something which adds on to your this comorbidities and will cause lots of dampening issues because COVID is just an RNA virus. It has not that much power to just damage your healthy lung. It can damage your healthy lung, but not that much frequency, not that much aspect. But what people understand is that COVID is something dangerous, but it's not at all dangerous. It's dangerous for the people who are already old or feeble or comorbid or having lots of different health issues. So for that, actually for those people it's quite dangerous, yes, obviously. But for our, I mean, this healthy population, yeah, it's obviously dangerous, but you must be precautious of it every time because this COVID can be dampening if you have second or third COVID infection on this on a perpetual manner because this COVID is something really dangerous sometimes. But what I see from the outpatient basis is that COVID patients generally do not come to tell you that please test me for the COVID. They feared it. People are already feared it. They will come with vaccinations, but they will not tell you that directly that to test me. It's impossible. They'll come with you for just with some kind of plain symptoms like the fever, like headache, like vomit tendency, like diarrhea, like some sort of flu-like symptoms, nasal congestion, this anosmia, loss of taste, loss of smell, dysgeusia. Sometimes they feel like some sort of dizziness in the head. There is dizziness. There is some sort of in the acute phases, like patients who did not care for COVID or who had fever for for a long period of time, didn't take paracetamol. Maybe took paracetamol but didn't take any other things which is necessary, like some immune boosters or some zinc or some other medications. They are quite vulnerable because they will start to develop symptoms like a respiratory distress, like some sort of breathlessness, okay, like some sort of panting type of illness. Yes, that's the main problem. It can cause your lung to get damaged. It's easily, it can just go in trains to the lung and then can damage your lung ultimately. But it's the ultimate stage. Maybe that's the fourth stage, which is credit. But in the first and second stage, if you just care it properly, then there is nothing much to worry about. There are lots of home remedies also available, with other people who are dietitians or who are expert in this. Just you can consult them for the home remedies, and also doctors are also suggesting for the home remedies if you are not comfortable with the tablets or all these things. But you need to do something at least, because only paracetamol won't help you. First of all, COVID is a big thing. COVID needs to be treated, and COVID needs to be taken care of. And if you just start your medications on a very early period of time, then you can get saved. Otherwise, you are just doomed. It's quite impossible to just actually rescue you, because at the end, I have even seen patients who have died on COVID and had their lung totally damaged. He had to just put on the this called ECMO machine, like this extracorporeal oxygenation. These sort of things are really, life-threatening, challenging for the doctors, for the for this health industry. But basically speaking, what I want to mention is that this COVID, if you scare properly at a fast period of time, then there is not that, at least there is nothing much to worry just regarding this COVID. But what we need to do is that, in which stage you come, we need to just take proper care to you, give proper care to you, and then give you the proper medications, just guide you in the proper way, so that it just you can get just at least some kind of at least some sorts of relief, some sorts of decrease in your symptoms like this. But basically speaking, people do not care sometimes. Sometimes people are ruthless. Sometimes people do not care for this thing. People are casual. They don't know what to do. Yes, they don't know what to do. This is natural. But if you don't take the advice of doctors as seriously, then there is lots of things you need to be concerned of, because your problem will get dampening very easily. And there are lots of seriousness we can just expect from it, because COVID is something which is not dangerous, which is benign, I know. But at the end of time, there are lots of things that can happen. And people also think sometimes that doctors are advising things. um, there are lots of mistrust or misbeliefs are there. There's actually, they start to think that whatever we are just suggesting you is not good. It's not good at all. But if you have COVID, you need to take a whole bunch of medications. The more medication you take, yes, it's good for you. But we need to take further precautions regarding the COVID, because if you have COVID, then we must see your kidney and the liver for the damage or not. If those things are damaged, then we will deliver you, or we will just suggest you the medicines accordingly. Otherwise, it's quite hard. Yes, for a healthy person it's okay, but for the benign, a person who is very much benevolent, I mean, a person who is very much, having comorbid things, for those patients is quite vulnerable. So for that reason, do not ignore COVID, and just carry on with your life. Stay a happy life.